I get a lot of people ask me, what about the confidential health analysis? Like, why is that the thing that we're going with? I really like it for a lot of reasons. Probably the number one reason I like it is actually on page 3, where if you look at the last bullet point on page 3 of the sample packet, it says Prilosec, otherwise known as omeprazole. And it talks about side effects, cancer, gastric tumors, vomiting, rash, constipation, cough, fever, pain, fatigue, muscle cramps, muscle and joint pain, muscle weakness, depression, hallucinations. Holy cow, right? So when we look at that, it gives me a really clear understanding that if we flip back to the very, very first page, which is a beautiful summary page, by the way, it tells us what the data was used, the patient information, their primary symptoms and complaints. They can look down at the very bottom component where it says presenting symptoms. That's page 1. And it goes through and it shows energy level is worse than it was 5 years ago. Sinusitis, indigestion, like there's these complaints. So part of what we're looking for is obviously, yes, the primary symptoms are important, but the presenting symptoms, all the other stuff that comes from the patient symptom survey, we can go through and correlate that with everything that's on the side effects for the medications they're taking. So that part's really, really important to me because as we start to peel back layers, we might have it fall away or it might not fall away. So it might be something where it helps me as a clinician steer my way through somebody's health journey to make sure that we're not getting stuck anywhere, because people hate mysteries and they hate getting stuck. So this ensures that we'll continue to progress through their care, through their health very quickly, easily, and without many problems. Now, speaking of that, making progress, the roadmap that we have, which is on page 2, it's the box that says primary findings suggestive of. Now, looking at this as a clinician, this doesn't tell me what the diagnoses are. This just tells me what things can happen because of what's in the blood. That's the beauty of looking at this through the lens of a proper analysis. It gives me different things that we could look for, and it also helps me to prioritize what I think is the most important thing. So, for example, in this one, it says diabetes, vitamin D deficiency, thyroid considerations, anemia, possible hemochromatosis, gastrointestinal dysfunction, inflammation of the liver, and a few other things, right? So the thing that I'm thinking of is if they're having a vitamin D deficiency, all of their hormones are going to be out of balance, and it's going to cause a lot of other issues, inflammation of the liver, so on and so forth. Also, the gastrointestinal dysfunction means that they're not digesting their nutrients. They need something that they can absorb. That tells me that there is a special line of products I think will do them the most good, and I can steer them away from things. I've had so many people that are like, oh, I'm taking my vitamin D, I'm taking my calcium, I'm taking my iron, and they're not showing up in the blood. It's because they're not getting past the first stage of nutrition, which is digestion. They're not digesting them, they're not absorbing them, they're not applying them. So this shows us what's actually in the blood. If it ends up at the destination where it's supposed to go, it'll show up on here. If they're taking it and it's not showing up on here, that means it's going straight through them and they're not getting any benefit from the supplements they're taking. So that's a really important piece for me. It also helps me pick and choose where I want to start, what I want to focus on, because if something on here is going to limit their progress for everything else, I want to start with that thing first. So that's super helpful. Now, as we go through it, we get into, let's go to bottom of page 4. It says Diagnostic Findings, which really then starts on page 5. Coronary assessment. It goes through and takes all of the findings that are on the test and shows what was checked, why it's important, what the normals are, and then how to correct that or how to treat for that. So if we look down, the next one down says diabetes. Talks about glucose, talks about the A1C. It shows that this finding is supported by, and it lists all the things that showed up on the test, which we're going to get to. That's on page 16. And then it also shows the presenting symptoms. It correlates everything right there. It's beautiful. It takes everything that there is to know about diabetes and how it relates to this patient, what the findings were, what the patient complained about, what the blood showed, and then the nutrients recommended is right there. So if somebody's main focus, maybe there's all these other things, maybe their main focus in this case on page 5 is diabetes. They say, this is the one thing I want to take care of first and foremost. We know that everything in the blood is connected. Blood goes everywhere, connects everything, and connects all things, all organs. So we want to treat the whole person, not just one condition. But we know that diabetes is very, very damaging. We know that it makes everything else take twice as long. It's twice as hard to fix and takes twice as much effort. And a lot of times that translates into dollars. So if we can fix that one thing first, or maybe a major focus on that one component, it gives us a summary of every bit of information that we need out of this whole test, all compiled into one nice, neat little paragraph. And it does that for everything as we go through. It shows the anemia, possible hemochromatosis. It shows the thyroid considerations, and it puts everything and it explains it all, and it's all right there. So this is really a patient's guide for themselves to explain to the friends and family, maybe even other doctors. They can take this and say, hey, see how these things are connected. It lists everything out there. This is a very transferable, portable record that all medical doctors should understand, and even other functional medicine doctors. You can take this in, and it's properly organized. It's ready to go. And then as we go through all of this stuff in the sample packet, we get to my favorite part. This is actually where I like to start when I jump in with people. Is page 16, and this one is the analysis. You get the blood test results. They're compared side by side. So if this is your follow-up or second or third or fourth one, you can see the change. They mark on there the delta. Either it's no change, you get a happy face or a frowny face. And that's really, really simple. Also, the first thing that popped out at me when I saw this is it's color-coded. And it's categorized into 4 different categories, not just terrible, which is where most medical records are. They look at the worst of the worst. They look at the bottom of the top 10% of the people that are the furthest out of range. These people get blood work all the time, and they're the sickest people. So your values are only considered pathological if they are as bad or worse than the bottom or top 10%. This, however, gives us a peek into finding wellness within the normal range. If the range is 100 and you're a 101 and you're sick, and if you're 99, do you think you're going to be mostly sick? Probably. You might not be pathological, but you're not going to be healthy. So this gives us an opportunity to measure a bunch of different things to see if they're optimal, if they're at a warning level, a high risk level, or a critical level. Now, critical is what shows up as disaster medication. That's usually when a primary care doctor will get involved. We like to get involved with anything that's going to take away your health or your happiness or your performance. So the other thing this does is, as we treat people, we know that sometimes the body will purge or flush. So we might see one of these values go up or down depending on where it's at in the range, and it might look a little worse. But if one value changes and we have measurements on all of these values and we can see that they are graded by significance, it might be that you have one of your yellow values goes to red, right? So that means a warning will go to high risk. But 3 or 4 or 5 or 10 or 12 other values might go from blue to red, or they might downgrade from red to yellow, or they might go from yellow to a green star, which tells you that you're making that progress. So the more thoroughly we investigate, the more clearly we define what we're working with, the easier it is to understand exactly what's going on and where you are in your health journey. So then if we skip ahead to page 20, this part right here is amazing. Because every time I've ever talked to anybody about blood work, the first question they ask me is, what do I do? Most of the time, the way that they've been coached on that is maybe make a change, maybe take another medication, or maybe just do nothing and we'll follow up in 6 months to a year. They're literally just tracking these values that change over time, and they're not really doing anything about it. And I think for my patients, that's the most frustrating thing, which is why this page solves a lot of problems. So when they say, Doc, what do I do about it? Well, here you go. Here's your list. And they're looking at this, and they can say, okay, well, what's this? What does it do? Why is it there? And I coach them to go back to the report. So if they're looking at pick anything, they're like, well, why do I take the Opti-EPA? They can flip back into the report on page 8. So if they're like, why do I take Opti-EPA? They can flip back to page 8 in the report and say noted blood values. Magnesium is high. It will describe to them all of the reasons that are involved. And then at the very bottom, it says nutrients recommended, Opti-EPA. So now you can start to understand why this prescription is this way. And it tells you exactly how many number of supplements, whether it's a pill or capsule or a scoop or a powder or whatever, it tells you what the number of servings are per day for that particular thing. And it makes a nice, neat little prescription that you can actually do something about your blood values rather than just waiting for them to get bad enough to need medication, which most of the time, by the time that happens, people are already so far gone that they have to make radical changes. Wouldn't it be nice to know sooner, to know earlier, to be able to take charge of your health so that you can make good decisions about your health, to stay away from all the dangerous things? And then I've had so many people that have done this. They've done a great job of it. And because they've gotten so healthy, their other doctor has no choice but to take them off of their medications, because it's illegal and immoral to give healthy people medication. So when people ask me, say, Doc, how do I get off of my whatever their medication is? First thing I tell them is, I didn't put you on it. I can't take you off it. I'm not a prescribing physician. I like to nurture and nourish the body's natural healing ability. So let's get you as healthy as possible. And when you are an ideal version of yourself, you're as healthy as you can get, you won't need as many medications or any at all. Some people still need some because they've taken so long to get to the part where they take care of themselves that we can't completely recover everything for them. But their life is 95% better. They're doing things they never thought they would. They feel 20 years younger. And that's the coolest thing about this is it breaks down everything so that it's easily understood. It's something they can talk to any of their healthcare providers about. They can show them this, they understand it, and it gives them actionable advice to take care of their health.